free preventive services. This is part 3 of 3 for women only. So what are those free preventive services your insurance offers? Here are the basics, what is covered, and some tips to help you along. I am your medical bill whisperer, a previous billing manager turned patient advocate. I am committed to bringing answers, insights, and solutions to patients like you. First, a quick disclaimer: if you have original or Medicare Advantage, Medicaid or TRICARE, this video is not really for you. You do qualify for preventive care services as well, but they are a little bit different. Let's go over quickly again who is eligible. If you bought your own plan on an Obamacare exchange or marketplace, or on the open market through an agent, or if your employer bought such a plan on the open market or through an exchange, or if your self-funded plan, meaning your employer decides on the terms of coverage and pays the claims, offers the same range of free services they usually do. So, what are the good news? Your insurance plan must cover preventive services without any deductible, co-payment, co-insurance liability of any kind to you. Yay! Now, in addition to the old adults services, which are featured in a separate video, that's part 2, women receive additional care, no cost to them. First, a well-woman visit per year. This is to document your health status and your personal as well as family history. Your doctor will assess your lifestyle habits, give you a physical exam, help you set healthy goals. Screenings are also included. And in addition to those reviewed under the video for all adults, there might be mammograms, bone density test, pap smears at no cost to you, as well as, should you be high risk, BRCA counseling and testing for potential breast cancer or uterine cancer detection. Urinary incontinence, STD screenings, drug use, tobacco use assessments are also included. There is also counseling available, for example, for sexual health, but also domestic violence. Should you consider not becoming pregnant, contraception is also included, but a word on that a little bit later on. If you do want to become pregnant or have just become pregnant, folic acid supplementations, screenings for certain risk factors such as preeclampsia or rhesus incompatibility screening, diabetes or STD will be available. You will also be checked for UTI or other infections. And should you be smoking, intervention support will be offered. Once baby is here, breastfeeding counseling is available to you, support as well, but also access to equipment and supplies. As for postpartum depression, your doctor can assess whether or not you suffer from it, evaluate the severity of it, and offer either counseling, a treatment plan, or a referral to a mental health provider. Your primary care physician or your OB/GYN can provide those services. As for some helpful tips, first, keep in mind the law has limits. For example, religious employers may exclude contraception services from your plan, or the duration of coverage may also vary, especially for breastfeeding equipment. It may be limited to 6 months. Diagnostic services that may result from those preventive care visits are not free. These are the scans, the labs, the tests, the assessments, or other visits used for the analysis and evaluation of diseases or medical conditions. And should you require treatment, those are therapeutic and therefore relating to the treatment of your disease. For curative purposes, also, these services would be subject to your yearly share of cost, deductible, co-payments, co-insurance, etc. Every time you make an appointment for a preventive care visit, remind the staff and your doctor, as the coding will determine whether services are covered in full by your insurance or not. Be mindful that these services are free only when delivered by a provider in your plan's network, and you can find one of those either by contacting your insurance on the phone or on the website. All have a Find a Doctor section or tab you can refer to. Last but not least, women are always last, it seems, at taking care of themselves. Well, preventive services help definitely keep your health as best as can be at no cost to you, so why not take advantage of it? Physical exams to support education, detection, assessments, etc. are all there for you to take advantage of at least once a year. So take advantage of it. I will place some links for additional information and resources, and you might be surprised as to how many such services are available to you at no cost. I thank you for watching. Your likes, comments, and subscribe help this little channel grow, and for this I am most grateful. Thank you.